You just had a wound, and do you have to dial a plastic surgeon every time? Wounds and humans are so inseparable. From ages, humans have always correlated wounds with plastic surgery. And those were the times when every surgeon used to perform all the surgeries, and you don't have to really find a plastic surgeon. But what about modern plastic surgery? We have more functional and aesthetic criteria to treat every wound. So, if you just had a wound, do you always dial a plastic surgeon? When you just fall over a floor or a rough surface, you might have seen your skin over the top abraded. Yes, and there is a slight small amount of bleeding always. Do you panic for an abrasion? Usually, it is easily manageable at home. The biggest concern for every person is, do I get a scar after my wound? When you have an abrasion, how do you manage without landing up in a scar? For a simple abrasion, you need not see a plastic surgeon all the time. You might have some bleeding points here and there, which is totally controllable, and it stops usually in around a minute. And then just go to some fresh running water, clean it thoroughly with soap water, and just let the bleeding points stop. Please don't try dabbing it with cotton, especially dry cotton. Mostly in a fall from the bike or a game fall usually ends up in little deep abrasions, and we see people ending up in the hospital. In most of the cases, in abrasions, cleaning and dressing up the wound is the only treatment, and you won't need a plastic surgeon for all the abrasions. Let's talk about lacerations or cut wounds. I think this is the point where everybody dreads after you have a cut wound. After a cut wound, we generally are pretty scared and we want to see a doctor, and most likely a plastic surgeon. In case a plastic surgeon is not available, what do? Most of the situations you are able to find a plastic surgeon, and a cut wound can be sutured very easily, but still they all form scars. The best part about being sutured by a plastic surgeon is your scar is very pleasing. You don't hate that scar. There are some scenarios where we see people saying, it's okay, I don't mind having a scar and I don't want my kid or myself to get sutured for this small wound. Okay, that's fine. But how many situations can you let them go? In some situations, there are wounds where there is continuous bleeding, and that doesn't stop even after pressure or any tight bandages. So, how safe is that to avoid going to a hospital in those scenarios? These wounds, you might see them mostly on some vascular areas. And these areas, in case, even if it's a superficial cut, might lead to continuous profuse bleeding. In this situation, a scar is not the concern for you to see a surgeon, it's your life. For most of us, they have left sweet memories. But today, with increasing availability and affordability to plastic surgery, it lets people to let go of these unwanted memories easily or not have them in the first place. I have seen many parents bringing their kids traveling around 200 kilometers to come to me just to get a 1 centimeter wound sutured so that doesn't form a scar on the kid. I totally accept this concern. Though it's completely needed to see a plastic surgeon after a cut or a wound, do you really have to get disappointed in case you don't find one? For every simple cut, the golden time of your suturing or your treatment is usually the first 6 hours. This is the time when the tissue is still behaving at its best. In case you find a plastic surgeon in this time frame and you're lucky enough, then your scar might result in a very pleasant scar. In case you can't find one in this first golden hours, do you have to panic? No, we again have a time frame that is after 48 hours. So try finding a plastic surgeon in the next 2 days, and still it can help in having a pleasant scar. All pediatric wounds, please try to deal with a plastic surgeon, because pediatric wounds leave scars which are kind of unpleasant. And in case, if at all you're thinking that your kid will have a better scar as they grow, no, it works the other way around. An unpleasant scar grows along with your age. What other kinds of wounds in adults need a plastic surgeon? Any cut or any trauma along your anatomical lines, your eyebrows, your margins of the lip, or your hairline, any line that is more demarcated in a body, have to be dealt by a plastic surgeon. In case there is a misjudgment with any other surgeon and they form a misaligned scar, this can leave a completely devastating look on the body or the face forever. Complex wounds are wounds in more than one dimension. There are 2-3 cuts in one area, or in case you have a suspicion that there is an artery or a vessel cut or a nerve cut. If there is a vascular injury, you will see that there will be continuous bleed, and which would not stop with any pressure or your home remedies. So please then rush to the hospital, because this can be life-threatening. In case the cut is a little deeper, still there's no bleeding, still you need to be a little worried, because sometimes this can affect the nerve. There could be a nerve cut inside, which can result, maybe not immediately, but in the long run, in motor and some sensory deficits. No, you don't have an option for that, because it can be a channel to a very penetrating infection, and that can go deep into your body, affecting any of your major organs. So we all know we can't avoid wounds or cuts or any small injuries on our body. So how to keep our skin ready to form a better scar rather than taking care of the scar later? The ideal way to treat a skin is taking care of the skin in the first 1 year of birth. That is the time when your skin is taking the maximum growth phase. You'll have to regularly moisturize a baby's skin. Regular or thorough moisturization of the baby's skin for the first 1 to 2 years of life is very important to show good healing and forming better scars later on in your life.